So I think my screen has gone live and I'm just waiting to see if it's going to tell me anything. Okay, cool. So that's good. I've actually managed to log in okay. Maybe just try to join me. And if I do that, that'll be absolutely awesome. I've never done this before. What a way to try it. So, can you hear me?
Hi, Marie. Hi, how are you?
Oh, there we go. That worked. Yes, I'm really pleased. I just had to Google how to go live because they changed where the button was on my phone. What's going on with me and social media at the minute? I need a course. So thank you so much for joining me, and brilliant that we've managed to connect virtually. So we're going to discuss today about scar tissue healing to do with abdominal birth and C-section scars. So just a little bit about Sam. Sam is a remedial and scar work practitioner specialising in postpartum recovery and has a specialist interest in caesarean section. And you can follow Sam on Instagram at sam_massage_therapy, and on Facebook it's Sam Massage Therapy. And your website's
Yes,
the same, isn't it?
yes.
sammassagetherapy.co.uk. So yes, you've got brilliant training and video tutorials on your site. I absolutely love them. So let's start off with about signs of scar tissue healing, if that's okay. What's healing well that looks good, and what might be looking infected? What are the signs that we need to look out for? Because that's so important in the early days.
Yeah, absolutely. And first of all, thanks for having me on. And I know that, a lot of what we're going to talk about today has really been instigated through questions that your followers have asked. So we've tried to bundle those questions up and put them all in, a nice wee interview. So, please feel free to comment if you want something, if you've got a burning question.
Yeah.
So yes, scar healing. It's so important, to have a really good think about this. So what I'm going to quickly discuss is the healing journey, and what it really consists of is four main phases. And once we understand those phases and what should be happening with the scar during these phases, then we know what to look out for when these phases aren't going correctly. Okay. So in a very brief, and I'll make this as unscientific as possible because no one likes a bit of science on a Wednesday afternoon. First phase is homeostasis, which is where we literally, in the first minutes and hours after the surgery, you've got bleeding and then it clots. And we're in a nice controlled environment with a C-section. There's people there to monitor that. They put the stitches in, they check for any signs of hemorrhaging. So that is a phase that really should pass us by without, really even acknowledging it. Second phase is the inflammatory phase, and this is really that first few days up to a week post C-section. And we tend to think of inflammation, like swelling, as being quite a negative thing. But actually, for wound healing, it's very important. Yeah. So I'm going to liken this a bit to like building a house. The inflammation phase is where you do the groundwork. So you clear the ground and you get your contractors in ready to start work, and they start doing the little repair jobs ready to start building. Okay? But this is a phase which a lot of people struggle with, because this is, and I always remember you talking about this, Marie, this is a painful bit. Those first few days after you've had your C-section, you will be in pain. And this is why we need pain management. It's really, really important. This is a stage where, your wound will be hot and red, and a bit swollen. And, we need to monitor this and make sure that swelling and that redness isn't going out of control, and sort of keep on top of it. And this is where, really the medical practitioners, the midwives coming around, the health visitors will be checking on it. Once those, you're out of that phase, and yes, and that should be by 7 days, by a week, you should be, radically feeling, out of pain. And if you're not, that's when you speak to someone. But beyond this phase, we then have what's called a proliferation phase. And this is where we start putting in the scaffolding. The body starts regenerating the tissues, albeit it's a bit of a bodge job, but it's the interim bit. Okay? Yeah. So it starts slapping down collagen. And this usually takes sort of 4 to 6 weeks with a kind of surgical wound like a C-section.
Okay.
So you want to be, keeping an eye on it, making sure that it's, things are healing over nicely. And then beyond that, we have what's called maturation or remodeling, where we put in a proper house. This is where the body then does a better job at rebuilding that scar tissue and, making it set for life. Okay. So those are the kind of 4 phases. But what we really want to consider is what are the red flags, what are the warning signs during these phases that something might not be going to plan, and actually then not to sit on it and go and do something about it. Because the sooner that you get infections or issues dealt with, the better the long-term outcome of a scar is.
Exactly. Yes. Yeah.
So
what are those?
Yes,
what are we looking out for?
So the major thing is pain. We've already mentioned pain, within that first week, which can be, really stop you in a track. But if that pain persists or you start getting new pain during the healing, this is really, a warning sign, sharp stabbing pains, things which, kind of stop you in your tracks, things which just don't feel normal, Okay, yes, you've had surgery, so there should be discomfort, and you might need to manage pain for longer with painkillers, but it shouldn't be debilitating beyond that initial phase.
So would you say within the first week is when we need to really medicate, make sure we're on top of our medication, and then after that week it should be becoming more like a general ache rather than that sharp pain that kind of stops you, particularly standing up and sitting down, or coughing, sneezing.
Yes, yeah.
That can be quite uncomfortable. So after a week, thinking about scar remodeling, should it be sort of going towards the achy phase, the achy, uncomfortable? That kind of
absolutely.
discomfort.
And I think sometimes we also need to think, are we doing too much? Because when you're overdoing things, then you yourself will feel unwell. The area will feel heavy. You will get more pain. So sometimes it's simply, your body's way of telling you something.
Yeah.
But of course, you've got a newborn. So, how are we meant not to overdo things? This is the hardest thing, The second thing is, obvious signs on the wound itself. Is it just not healing over? And it might just be one little bit. The amount of women who come to me and they just have, literally a spot which won't. It might be down to the way that a particular stitch hasn't dissolved. It just doesn't seem to get past that healing phase.
Right.
And this can go on for sort of months. And you want to get that nipped in the bud as soon as possible. And again, the way I compare this is if you had a cut on your hand, 3 months down the line, you would not expect that cut to still be open. And it's exactly the same for your tummy. Think about what would actually normally be acceptable and not acceptable.
Yes. It's really good advice, actually. Yeah. So if you're still getting pain around your stitches and your scars further down the line, is that something we should definitely go and speak to somebody about?
Yes. Yeah, absolutely. And most people, well, it's been difficult at the moment with COVID, but, most people can get a 6-week check and should flag up anything at the 6-week check. Yeah. And that 6-week check is at 6 weeks because that's a good time in terms of what is going on with the healing.
Yes. Yeah. So important, isn't it? Yeah. Totally.
The other common things, swelling, sudden swelling, sort of pockets of sort of puffiness which just suddenly appear. All these things should be checked out. Lots of itchiness. Smell, absolutely, yes. Yeah. And even sort of vaginal discharge smell. Something, doesn't smell right. Then, these can be signs of, because obviously we've got the deeper healing wounds as well.
Yes, from the uterus, and of course, I didn't think about that one. That's a really good one, right? Yeah, and obviously the gap, like you said, not being closed in that one section or more. How long should the scar take? I know it's a bit of like how long's a piece of string, but how long roughly should we expect the scar to still be knitting together? Should that be done in the first week or 4 weeks, or everybody's different?
I would say everyone is different. 4 weeks is a good standard.
Rule of thumb.
It can take some people a bit longer at 6 weeks.
Yeah.
But by 4 weeks, you should have a kind of a layer of new, if not, it's, quite fragile skin across the top.
Yes, yes. So
Um,
obviously, don't
yeah.
start doing your weights and pushing the Hoover around then. But
Yes.
hopefully, you're not oozing and it's not smelling and itching and yeah, it's still painful at that point. So that's
Yeah.
really good. Yeah,
And
wonderful.
it's really good to bring up the itching, because the itching is,
Yes.
again, something that is a natural side product of the healing.
Yeah.
That's a good sign that the nerves are coming back. But again, I've had women who have had a really prolonged itching phase, an
Right.
intense itchiness.
Yeah.
And, that's not right either. So beyond that proliferation stage,
So that four
you
weeks.
know,
Yeah. 4 to 6 weeks.
even slightly longer, actually, sort of going up to
Okay.
sort of maybe around 8 weeks. If it's still itchy and it's intolerable, then
Yes.
that would suggest there's something not quite right.
Okay. Well, that's a good
And then,
one. I don't often think about that one. I mean, itchiness in general is not right, is it? Actually, when you think about your common sense hat, that obviously when you've had a baby and you get no sleep, completely kind of disappears. But yeah, okay, that's
yeah,
a really good one to point out. Yeah, thank you. So how
and
can we
then
promote? Oh, sorry, is there another one? Going.
yeah, I just want to mention one last thing. Well, because that's all the superficial scar,
Oh, yes.
but we always forget that there's deeper scars. And even me, who went for a C-section and had anatomy background, took me a while for the penny to drop that, there's healing going on deeper.
Yes.
It,
Yes.
and we can't look at the deep stuff and see visual cues. So this is where you really need to give cues of pain. If there's pain, and you can't see anything visual for it, that's why you need to get checked out. And then you've got the longer term potential effects of adhesions. So
Yes.
the inflammatory response produces adhesions. If we get trapped in that inflammation period, that phase, then we get more adhesions. And adhesions are exactly what they say on the tin. They're adhesive. They stick things together.
Sticky.
And this
Yeah.
is where we can get issues in the pelvic cavity to do with organs and potentially prolapse. It can affect lots of things,
Pressure. Yeah.
pain on penetration, put in tampons, one-sided back pain, that kind of thing. Might even affect menstrual cycles. So these are kind of, I would say, they're longer term red flags.
Yeah.
And these are all things that you need to get checked out by your GP gynae, but could be rectified with scar work.
Yeah, it's so
So,
important, isn't it, that we're taught these things, particularly, yeah, before we leave hospital. But I just don't think this, I think this is really lacking, this area of information. So it's so good to be able to chat and have these conversations, and just get rid of some of the myths, because even me, sometimes I question things. So it's great to hear it, how the healing phases go. So how can we promote the scar tissue healing ourselves to help with our recovery? That's a big thing, because I know lots of people can't get to places with COVID as well at the minute, but obviously what can we do to help? And does it help if we start things, and when sort of should we do that?
yeah, absolutely. I mean, it's such a great question. And I think, let's be more in control of our own healing.
Yes.
Things happen, but if we can try and be on top of it as possible, then it makes a huge difference.
Mm-hmm.
So there's really obvious things like, and when I say obvious, it's not always that obvious.
No. Yeah.
And if you're going for something like an elective section, you've got that, almost that beauty of really trying to prepare for
Yeah.
your surgery. So things like, a balanced diet, hydration, getting your body ready so it's in the best state for healing. Reduce your sugars. If you drink alcohol, then that's not good for healing. If you
Right.
smoke, and unfortunately, it's really difficult for people who are nicotine dependent to give up during pregnancy. But nicotine is not a good friend for wound healing.
Yeah.
Like, it reduces the oxygen carrying capacity of the blood,
Yeah.
and that blood needs that to help healing.
Yeah.
So, these are things that we need to take into account. Other things like rest, it's underrated. You know, we, but
Yes. Massively.
it's so difficult when you've got a newborn. And hopefully now we're kind of, well, in Britain, we're seeing the sunshine on the other side of COVID. We can get that support network around us a bit better, and rely on other people. And we really should be, taking that help and giving ourselves as much of that rest time as we can. not putting pressure on ourselves to do things. The quality of rest, the quality of sleep. If we're doing night feeds, don't sit on our blue screen, mobiles while we're feeding, because that's not going to help us when we go back to bed.
Yeah.
So small things like that, try and aim for
Lifestyle
quality.
things.
Yeah.
Yeah. Yeah.
And that kind of goes hand to hand with stress as well. Stress is a normal thing. We all have it. But do you have an unhealthy level of stress? Because if you do, again, that is taking the energy away.
Healing.
It will,
Yes. Yeah. Yes.
yeah. Um, and then there's things we can do. There's great
And it's so
stuff that
funny.
you
It's so
can,
funny for you to say that. Sorry.
because it's so obvious, isn't it? But it's not, you know. But also, I
No,
think
and I
stress
think
is
if
really
you first
difficult.
time, yeah, yeah, first time mum, you're giving the baby and you've had a cesarean, and you just, where's the support for the mum's not there? This is what the big thing is. Yeah.
Yeah,
Yeah, I know someone's
yeah,
commented here that they had to go into hospital with a 20-day-old baby and they weren't allowed anyone in to help look after them. So they had to help with the baby. They did everything themselves. And at 20 days, you're still in recovery mode, aren't you? And then now he's got a lot of pain.
absolutely.
So that's over. It's a classic sign of your body's overdone things and you just haven't had the support to help. I mean, it's not right. Yeah,
Oh, what a shame.
yeah, yeah. So do go and see somebody if you're still in agony. Please get some painkillers. So yeah, it's a sign of deeper layers, not being happy to take on that weight, isn't it? Pressure. Yeah.
And but there are things that we can do. So I'm going to talk through sort of the more physical aspects of what people can do. In when I say the early days, we're talking like once it's covered over. So
Mm-hmm.
once the wound has healed,
Yeah.
albeit superficially,
Yeah.
there's things which we can do to promote a healthy scar growth. Okay,
Mm-hmm.
so the first thing, and this is going to sound really random, but it is so important, is actually hydration on the skin. So scars do not like being dry. If they are dry, they become overactive and you get more scar tissue. And having excess scar tissue is what creates that kind of ridged, hardened scar.
Mm-hmm.
Okay, so moisturizing your scar um, 3 times a day is best. Is really crucial, and there's lots of amazing products out there that you can use, from completely natural sort of vitamin E rich products.
Okay.
I'm in Glasgow, and there's a lovely company called Cubby Salve, and they make a scar bar. And what I would say is, in the early days, you'd want to rub it onto your fingers and use your fingers to apply it very gently. Um, and you've got rosehip oil products as well, which I've seen on the market, which are meant to be very good for scar healing. To really scientifically developed products which have both anti-inflammatory and antihistamine and moisture barrier locking properties in it. So a really good one is a product called Alhydron, or
Mm-hmm.
sorry, Alhydrain. So I'll
Okay.
put it in the links afterwards.
Yeah, great.
And so they developed this amazing cream, and I think particularly if you have a slightly itchy scar, so moisturizing 3 times a day is crucial.
Okay.
The next one is touch. So by touching the scar, and this is where we kill two birds with one stone. We touch our scar to moisturize it.
Yeah.
Okay? And then we're stimulating the scar at the same time. And it's that stimulation which will help the nerves come back, and make that connection, that neural connection between brain and body.
So
And
just
over
to,
time,
sorry, just to clarify the time scale on that is once the scar's fully knitted together, isn't it?
yes. So we
Yeah.
don't want to do any of this if there's open wounds at all. So
Yeah.
if there's anything which is, still red, angry, or even, tender and painful to touch, no, you leave it.
Okay.
Okay.
Yeah.
So
Perfect.
normally, I say normally, but we are all different. 5 to 6 to 7 to 8 weeks, So if you're on the lucky side of it, then sort of nearer 5 weeks.
Earlier.
But
Yeah.
if I would always say err on the side of caution, because the other problem is at this point is that you have numbness, and numbness is normal.
Yes. Yes.
So you don't want to run the risk of accidentally pushing in too hard. So
Yes.
this is why I say when you're applying a cream, most people know, how softly they can
Light.
apply a cream.
Yeah. Light
Yes.
pressure. Yeah.
Yeah.
Yeah. Great.
And that touch is so important. However, I know that a lot of people, and again, this is really normal, touching your scar gives you the heebie-jeebies. Like it's so common and such a normal response to have, and it can give you the heebie-jeebies for usually two reasons. One, because the skull I can't say it now. Let's see, the scar it physically repulses you, and that's quite a strong word to use, but
Yes.
I think that sort of reflects it quite normally. And what I would say is, if you're not ready, then you're not ready. You don't force yourself to do anything. Don't feel I have to do this if it's going to, not help you.
Yeah.
Um,
Would you say there, Sam, that maybe if your partner's willing to do it or another family member, is that beneficial more to let someone else touch it if you can bear someone else to rub your skin rather than you doing it yourself? Would you still say if you don't mind other people doing it, that's good to let them?
Absolutely. If and I don't mean this, if you trust them and you want
Yes.
them to,
Yes.
then yes.
Yeah.
And
Okay.
it feels okay.
Yeah.
The other thing is some people find that actually because if they're touching their scar to apply a product, then it's got a purpose. So it's not
Yes.
like just touching for touching's sake.
Yes.
So sometimes actually that's easier.
Yeah.
Um,
Yes. Perfect.
the other thing is that you might not want to touch your scar. It gives you the heebie-jeebies because it's connected with a lot of unwanted emotions. Right?
Yes.
And again, this is very common, and those emotions can reflect lots of different things. And it might be actually you can touch your scar, but you still have those emotions.
Yes.
It's not but one that always
One or the
links
other.
into the other.
Yes. Yeah.
Um, so I think it's important that you acknowledge those emotions and just kind of clock in with them. So some people find that they feel quite anxious, quite overwhelmed, flashbacks, nightmares, insomnia,
Yeah.
anxiety. Oh, I said anxiety, didn't I? Hypervigilance.
Yeah.
Um, and I think again the key thing with that is A, to acknowledge it, but B, if over time, if over 6, 8, 10 weeks, these emotions aren't getting any easier, then that side of things needs to be healed as well. That's
Yeah.
another healing journey that you need to go on. And, speaking to your GP, find out what provisions there are out there. Because it might be that birth, the surgery, whatever part of the journey has kind of left some trauma on you, and it's really not that uncommon.
Yeah, and there's a lot of people out there talking about scientifically, there's lots of evidence and research about energetic trauma in your pelvis, particularly following a cesarean birth, that the energy, because it doesn't release down through the pelvis and that the baby's not birthed out of the pelvis, it gets stuck. And a lot of people apparently can't relate to their pelvis, like energetically, it's stagnant. The energy's not flowing. So I know a lot of energy healing therapists say, just placing your hands around your tummy with clothes on and just trying to breathe into your scar to try and help with the emotions is another form of scar massage therapy that's not hands-on, but it can do a lot of releasing work for you emotionally, which I think there's a huge part of that involved. Massive.
That sounds spot on in terms of. I know Lynn Schulte
Yes, Lynn
sort of talks
Schulte.
about this a lot.
She
Yeah,
does. Yeah.
um, and I think again, it's about you going on your own journey with your scar and doing what's right for you at the right time.
Yeah. And it's not at 2 weeks it's this and at 4 weeks it's this and at 6 weeks. It's not. It's so different. We're all different. We've all completely made up different. We've all carried differently. So yeah, it's what feels right for you, isn't it? And trusting your body and listening to it, your intuition. If you're in pain, that's not right at so many weeks, go and get further help. So yeah, so
Yeah.
important. Thank you for clarifying that.
And I think again, not sitting on the issues because it's so easy to do so when you've got
Oh, yeah,
a newborn, but
yeah,
actually going and getting them seen to. Because I
yes,
think the worst thing is ending up in that spiral of we basically get stuck in the inflammatory proliferation phases,
yeah.
and
Can
then
I,
that's
I would like to ask a question about the inflammation. I remember when I had my second baby that I had a lot of inflammation around 12 weeks. Like, a lot of people to say about the overhang, where the tummy's overhanging the scalp. I was very inflamed. So is that normal for it to get a bit worse before it gets a bit better? Or I know there's lots of people talking about, oh, months down the line, I've still got this really swollen bit above the scar. Or is that a sign of the inflammation phase going on too long?
To me, that would suggest it's going on too long and
Right.
something has interrupted that deeper healing, whether it's doing too much too soon.
Lack of sleep.
Um, but I know,
Sure.
the other thing is a C-section is major abdominal surgery.
Yes.
So we kind of forget that our deeper insides of us have had quite a bit of physical trauma.
Yeah.
So I would always get it checked out, but longer inflammatory response isn't that unusual, but
Right.
should be checked,
Checked
if
out.
that makes sense.
Perfect.
Yes.
Thank you. Just asking that. So a quick question. One of the questions I get asked a lot is that why does my scar look thickened? And I know personally from my own scar, it's quite neat at the edges and in the middle, it's quite keloid, which is like a thickened fat, like a worm, I would call it. Or you can get like what we call hypertrophic, where lots of scar tissue lays down, and sometimes that might look a bit wider than opposed to a neat line. Because why does that happen? Can you explain that? And what should we do?
Yes, so actually I think you had them round the wrong way. So hypertrophic is when we just get an excess of the proliferation, so it makes it raised above the actual scar line.
Ah, okay, yeah, that's what I kind of meant by that, yeah.
Yes, and that's quite normal during the proliferation stage, but it should then flatten out during the maturation remodeling
Right,
stage. Oh, and I don't know if I said, the remodeling stage can take up to 2 years. So,
right,
your scar changes over a long time.
yeah,
Keloid is when actually during the maturation phase, I hope I've got this right, you then get an excess of collagen and it spills out over the edges.
right,
So it can be down to genetic makeup. Some people seem more predisposed than others to keloid scars. And I think it can really knock your confidence. So can hypertrophic scars as well. It's
yeah,
because visually you're more aware of them. They catch on close. It knocks your confidence. So the reason we get this is because at some point, so I'm going to talk about hypertrophic because keloid, it's not so easy to know why keloid scars happen. But with hypertrophic, it is this overproduction of scar tissue at a particular point. So, and it's very common on a scar to maybe have a section which is completely flat, and then you have a little bit of hypertrophic, because usually that's maybe where there was a bit of infection or an increased tension along that part of the scar, which can, so if it's been contracted or there's been a tension across that line, then it can, that will stimulate overproduction.
right.
So the thickened areas are where we've had excess scar tissue created.
Ah, okay, so that's what that tells us, right.
Yeah,
That's so
and this is
interesting.
why the things like getting the moisture on, going to the antihistamines, touching it, and I don't know if I mentioned the compression as well. So compression during sort of the maturation phase and even sort of way beyond that can be quite good at dealing with hypertrophic and keloids.
And what weeks are those
So
roughly? What would you say the maturation weeks are again, just to remind us about what we're thinking?
usually around where are we? Usually around 2 or 3 months onwards,
Okay, yeah,
up to like 2 years.
yeah, okay.
So for compression, some people use silicone strips. I don't know
Yes,
if you've come across these.
yes, I have, yes, yeah.
So these offer, not only are they great because, oh, my headphones falling out, because they lock in the moisture and create a barrier, but they also apply a little bit of pressure, and that can mitigate the amount of proliferation.
Right. Yeah.
Yeah. So
And they work
there's a
well. They do work
couple.
well. We use those a lot in the hospital.
Yes. So I've got one here by a company called Circulux,
Ah.
and it's actually got a little bit of basalt rock in the middle,
Oh,
and you heat that up in your microwave, and then that offers some heat as well, which is great for healing.
right.
They have to be used long term, so usually it's a minimum of 6 months that you would wear it for all of most of the day basically.
Yeah.
And you just apply it on, and then it has like a strip that you put on top of it to keep it in
In
place.
place. Oh, wow.
The other, so that was actually part of a C-section recovery pack.
Oh,
Another
okay.
product is BAP, who are a Danish company, I think, Danish or Dutch. Sorry, BAP. So we'll just go BAP. And they produced an amazing recovery pack called a C-section recovery pack, and it has lovely silicone strips in it, which are washable.
Oh,
So
wow.
you know, can reuse them, and I think the pack lasts for about 2 months. Then you'd have to buy a new
We'll
one.
have to write that down for people if they're interested to look it up, how they
Yeah.
find it, because I've never heard of those. They sound very, yeah, amazing.
So the product's called Scarband. In fact, it's the same company which produces our Hydran cream.
Right.
So they're kind of at the forefront
They
of
are.
scar
And I've
care.
never heard of them. So isn't that interesting? Gosh. Yeah.
And, you know, even things like in the creams as well, I've got the Medi Honey as well, which is a kind of Manuka-based cream, which
Okay.
is meant to be really good. Beeswax based is good as well.
Yeah.
So I think if you are prone to keloid scars, and most people know if they are because they quite often are prevalent during teenage years, then you know it might be worth investing in silicone strips for that bit further down the line. But if you feel your scars, so our the BAP company recommends that you start off with a cream, and then at sort of around 8 weeks, if the scar's not doing what you want it to do, then go on to the silicone strips as well.
Okay. That's great. And just to
So
clarify, if someone was thinking, have I got a keloid scar or do I have a hypertrophic scar? What do they look like? How could we, so how would you say it looks? The keloid to me, I always think of a worm, like a wiggly worm. It's a bit
no, so I
raised.
would say that's
Is that
hypertrophic.
hypertrophic? Oh, right.
Yes.
Okay. So I am getting them mixed up. Sorry. Correct me.
Keloid is almost more bulbous, where it actually
Bulbous.
spills out over the edges.
Right.
So you could, so very, I don't mean very commonly, but teenage women quite often will have like a wee bit of acne on their shoulders, and then their bra strap rubs, and so for one spot you end up with a kind of proliferation, you
Ah,
know, quite a
okay.
big keloid scar.
Right.
You know,
Right.
whereas hypertrophic is literally it just sticks out. It's
Yeah,
basically
I'm
what
thinking,
it
you're
means.
right. I'm getting them mixed up. Hypertrophic, I thought was the other way around. Okay, learned a lot today. I had a hypertrophic scar then, not keloids. God, yes.
They
Okay.
can look very similar, you know, especially if
Yeah.
it's not on the extreme side of keloid.
Yes.
But
Okay.
the scar work I do can work really. So this is the thing, you know, further down the line, if you're unhappy with the look of the scar and it's, you know, knocking your confidence, and especially when you've got that hard ridge, and it sort of means that the tissues don't sit nicely, then this is where scar work can really come into play. You know,
Yes.
there's only so much we can do ourselves, and
Yes.
the products really help, and the early intervention is key.
Yeah.
But actually, you know, getting in and getting scar work done on them is wonderful.
Yeah. Yeah. And is there an optimum time you would recommend that with in terms of visits to see a therapist as opposed to self-managing at home?
So, it, in terms of timescales, the earlier the better in terms of making a good, fast change. So most scar workers, so for like myself, I will see people from around 3 months onwards,
Okay.
because I want to ensure that the deeper scars have healed.
Yes.
Although I will always start off with very superficial work. And the thing about scar work, so I trained for a lady called Sharon Wheeler. Her style of therapy is incredibly gentle, so it will not or should not cause discomfort. Okay, and we work in very tentatively because you know the body can have responses. So you know we're trying to just work with the body to make gradual changes, but those changes do happen better earlier in the scar healing because there's more blood flow, there's more things happening.
Yes.
Saying that, it's never too late. It's just
Yes.
that
Good.
if I
I was just going to
if
ask
I see
that.
someone, yes, exactly. If I see someone maybe 5, 10 years down the line, it's just that those changes will take longer to achieve,
Okay.
and it tends to be a more gradual process
Yes.
or a slower process.
But you can still affect change years down the line
Yes,
if you haven't thought
yes,
about it or known to ask. Yeah.
yeah,
Perfect.
absolutely, yeah.
Perfect. That's amazing. And I think the one last question I'd really like to touch on, because a lot of people ask about this, is about the numbness. To discuss scar tissue numbness. Is it normal? Is it common? how long should it be there for? Should it disappear? Does it go away? There's so many questions.
Yeah, I love this question because again, I have so many clients who are like, they come from me for completely different reasons, and they're like, "Oh yeah, no, I'm your numb. Like I'll be numb forever." And you're like, "No, it doesn't have to be that way."
No, yeah,
So the numbness is part of the healing. It's normal to be numb at first, but as the area heals, the numbness should recede as well. So you
yeah,
should get sensation back. For the unfortunate few, where maybe, for whatever reason with a cesarean, it, things have just been too damaged, then there might be areas where they never get full sensation. And I think also, it's important to note that numbness isn't just about not feeling anything. It's also about an oversensitization. So you get people who want the area desensitized in a way because their awareness is constantly drawn to it.
yeah,
And that overprotection time they're holding their baby, and or the heel rubs against their belly, it's sore, or they can't wear trousers where the waistband rubs on
yes,
it. It constantly
yeah,
produces this kind of, so this can all be worked on. And I had a lady recently, when I could practice before
yeah.
COVID, 5 years post C-section, no sensation at all, and simply by touch, she was getting tingling by the end of one session, and she was just like, "Oh my gosh,
Can feel
it's
something. Yeah,
you're just reawakening the area." And if you
yes.
always avoid the area and never touch it and never go near it, then it gets lonely.
Heightens. Yeah,
Yes.
yeah, yeah. And you need to start there, really, don't you? If you've got such pain, like heightened sensations relating to numbness, you need to start with desensitization work actually before you can even think about moving on to massage work or anything. Yeah, exercise, even exercise, I would say as well sometimes.
Absolutely. I was just going to come on to that because a lot of people say, "Oh, well, I've put up with it for 5 years, so, I'm not actually that bothered about it." It's not just about being able to feel your tummy. It's about the signals that your tummy can give your brain about what's happening in the area. So, to think of it on a really superficial level, if you went back and did exercise and you're doing stomach crunches, and you don't get signals that you've done too much because that area is numb. So,
Yeah.
we need to think of this numbness more in a like how it actually really affects the function of our body, and not just, "Oh, well, I can't, if I press my tummy, I can't feel it," but that's no biggie,
Yeah.
there's more to it than
It's
that.
so important. And the other one that I would say, and I think I did this twice when I'd had my second one, I burnt my stomach on the oven twice. Because I guess I just
Oh,
wasn't aware how close I was, and I had that lovely line singe, and that I think is quite common. That again, you're a bit numb, you're a bit unaware of where your positioning is, and you catch it. Done that. It's bringing the oven, it's bringing the tray out of the oven, and not realizing your tummy's like still sticking out, and you catch it before. Yeah, I did it twice, so I can imagine that's. I hope other people do that, and it wasn't just me, but I think it is desensitized to the point where even heat, got to be
yes.
careful. Yeah. Yeah, so be careful
Yeah.
with burns.
And wearing a bikini, you can't feel
Yeah.
when you're getting sunburned.
Yes. Yeah. Skin. Yeah. It's so incredible, isn't it? It's such a yeah. So scar tissue therapy. If you someone who had numbness and a lot of pain, what would you recommend for those people in terms of they do?
Oh, sorry, that broke up there. I didn't catch that
Oh no,
question.
sorry. I was just if someone is numb and struggling with a lot of pain, because a lot of people that contact me have got this horrendous numbness and pain, would they contact you? Would that be a good time to come and see you?
I think in terms of pain always needs to be checked out.
Yeah.
So I think if you're in a lot of pain, go and speak to your GP first.
Yeah.
I don't mean let's rule out, but getting an ultrasound, just checking for what's going on in there, it is really important. But then once everything's ruled out, then quite often I work with people both in terms of scar work and breath work, and actually it's about relaxing the tension in the area, because
Yes.
quite often post C-section, we hold ourselves in a really protective way.
We do.
And we're ultra aware of our tummy. So we suck it in like it's kind of no tomorrow. And that can cause more problems.
Yes.
And we want to get to that point where we start to feel confident about our tummy again. And, we don't have to love it, but we just have to accept it for what it is. I don't mean that because it's a grieving process in itself. But just to start to feel a bit happier about the way it sits, the way it looks, and we can relax it, and and get some, and that will allow the rest of our body to function a bit better.
Yeah, I think that's so important. I think a lot of people have always thought we have to strengthen, but actually we have to release and lengthen before we can strengthen. And a lot of us are not in neutral. We're kind of in that clenched
gripping
position. Grip. Yeah. Oh, it's so fascinating. I could talk to you forever, but I don't want to take up any more of your time because I'm so sorry. We have talked longer than we thought we would, haven't we?
It was kind of obvious, wasn't it?
Yeah, there's so much to pack in. But so if anyone's got any questions, please do put them in the comment box. We can always go back over them. I think we answered the ones that were coming through, which was brilliant. I will try and save this, download it, and then hopefully you've got it too.
Yes.
But I think yeah, great. It's so good to chat to you, and I would love to chat more. I'm sure every April we'll have to book in and keep chatting about this because there's always so much more to say.
And I think just trying to get the message about normalizing what should be happening with a C-section, what is normal at what point, because I get so many clients come to me and, things should have been seen to before, please don't hesitate. And it's so difficult at the moment because people don't want to contact their GPs. They don't, but, if something isn't healing, you need to investigate why and get it healing,
Yeah. Trust your body and trust your instincts. Even though we feel disconnected, we are still connected, and we just need to trust that gut. Yeah. Oh, thank you so much, Sam. It was lovely to speak to you
thank
today.
You for having me, and thank you for everyone who's joined us. I really appreciate it. It makes it so much nicer when you know that people are watching.
Yeah, and asking questions, it helps too, even though we still have like a gazillion ones written down. But yes, well, enjoy your day, and we'll speak again soon. Yeah, thank you.
Take care.
Bye.